Hi, I'm Dr. Mukesh Gupta, obstetrician and gynecologist from Lenest, Malad, Mumbai. Hi, welcome back to our channel, Lenest. It's a channel dedicated to women in childcare. But today we are going to pick up a topic which has become the talking point for everybody across the globe when it comes to healthcare. And that is the COVID-19 or the coronavirus coming from Wuhan, China. Well, as the COVID-19 name has suggested, it started somewhere in the end of 2019 and now it has become extremely a big challenge in the early 2020. So today, in first week of March, when I'm preparing this video, presently thousands of people have lost their lives. But for every one person who has lost their life, there are another 50 almost people who have been infected by this, and another several lakhs of people who are at risk of getting infection. So let us try to understand some basic things that we need to know about this virus. There's no doubt that we need to know what this virus is, why it has become a problem, and how we can use some prevention strategies. Treatment is yet to be found out to solve this problem, except for the supportive treatment that is available. So this is what we're going to discuss in this video today. So let's start with what this virus is. It's a type of coronavirus family, which is already actually a very popular and a dangerous virus across, which has got a huge spectrum of different strains. Some of them are very mild respiratory or rhino infections, and other are actually causing tremendous problem and pain over the years. So a lot of these outbreaks, like the SARS outbreak or the MERS outbreak earlier, have been extremely dangerous outbreaks in the past, in the near past, when we talk about the medical history. But this coronavirus today is a challenge because it changes its form rapidly and gets mutated. Hence, the vaccine prevention strategy is not easily available. And hence, the antiviral drugs which are being used are not as effective as it would be with the other viruses. So that's why it's creating a huge challenge. And second thing is, it spreads pretty fast and very easily. Although, with the present understanding, it may be mainly through the droplet nuclei which comes from a sneeze or a cough of an individual, or secretions from an individual, which when enters the mucous membrane or the respiratory system of a person can cause an infection. So it is not by touching the human being or speaking to the human being, but it is by the contact that virus gets transmitted where it can lead to a trouble. So this brings us to the point to understand how can we protect ourselves and prevent ourselves. So golden tip number one, avoid going to places where there are already infected people. So you have common sense and you don't go to crowded places unless it is really necessary, especially if you are pregnant or especially if you have a little one. Second, if you know that someone is infected in the house, take appropriate precautions and maintain the distance. They say approximately a distance of 1 meter by the caretaker from the person infected is a reasonable distance to protect yourself, because these viruses don't fly in the air. It gets transmitted through droplet nuclei. Third, maintain hand hygiene protocols. When we talk about hand hygiene protocols, you need to wash your hands regularly, clean them up, and do not touch here and there. And especially if you touch, don't bring it to your face, and don't touch your face, nose, face, because we have a tendency that we touch everywhere and then we bring our hand and we sit comfortably on the face. That looks very elegant, but it is stupid when it comes to infection transmission. The next important thing that we need to know about is how to use a mask. Now, WHO has given wide guidelines about how to use the mask very recently, as recent as probably January. Now, what is it that you need to know about the mask? So when we're talking about the mask, first is who should use this mask? A, the person who is infected. B, the person who is a caretaker or who prevents or wants themselves to be protected against the infection. So these masks are to be used by them, and it is very easily available now. But yes, you must be finding it difficult because more and more people are asking for it. Now, what are these different types of masks? There are simple masks which are available, which are 1-ply or 2-ply masks, which are easily available. These are the surgical masks which are there, but they may not be as protective against the viruses, okay? But they may be hugely protective against the larger droplet nuclei or larger particulate matters that you come across. The commonly used masks for prevention against viruses is the N95 mask. Now, these are standardized masks which are regulated by the quality in which they are manufactured. If you read closely, you will see that NIOSH is a number or terminology which is written on the mask, each and every of these N95 masks, which tells us what is the standards they are maintained, and it is quality approved. So now these masks, how do you use them? Now, when you are using these masks, remember that wear this mask appropriately, of appropriate size. Suppose if you are wearing this mask, the first thing is that you're putting it across on the bottom, and then you're putting across your face over the ear. Now this has to be snugly fit, so you have to make it tight so that there is minimal leakage of air or particulate matter from the sides, especially the chin. On the nose, there is a metal strip which you need to press and bring it close so that now it is quite fixed. Now, one thing that you have to remember is you cannot keep touching your mask here. Avoid touching your mask, okay? And if it is getting soiled or if it gets wet because of your saliva, you need to dump it off and you have to dispose. Now, how do you dispose and how do you remove the mask? Again, for removal of mask, don't touch the mask, touch the strap, okay? And avoid touching the mask because that is now containing infected material. And then it has to be disposed of in a biohazard waste disposal bag, and you put it and then you knot it up, okay? So this is the way you dispose the mask. But remember, there are two things that you need to know about hand hygiene. Before you wear the mask, the protocol says that you need to wash your hands with soap and water or an alcohol rub, and you have to clean your hands. When you're cleaning your hands, whether it's soap or water or alcohol, you have to see to it that you take care of your fingertips, you take care of the grooves in between your fingers, and of course the whole of palm, the front and the back, up to the wrist. Either soap and water or a gel based hand rub or an alcohol based. Alcohol based is one which is one of the most preferred nowadays because of obvious reasons, because alcohol in itself also works as well as it gets evaporated quickly. Next important thing is that it is not only necessary to use this hand hygiene techniques before wearing the mask, but even after wearing the mask and when you dispose it off. How do you dispose the mask? It should be disposed of at a nearest waste container which is available to you, and avoid touching this, but use the strap to dispose it off, okay? Now, what if someone is infected? What precautions? The person who is getting an infection should be wearing a mask to prevent the infection being spread to the others, near ones and dear ones. Isolate yourself. For mild symptoms, the recommendation is stay in the house. Contact the hospital before going to the hospital that you are having a suspicious lesion and you want to meet the doctor. Don't try to keep it secret. On the contrary, inform the hospital, because you may reach a hospital which may not have the facility to take care of you. Not every hospital has that kind of setups to isolate you and take care of you. And they may want to ensure that when you walk into the hospital, you do not give infection to other people who are already sick and low on immunity. You don't want to do that. You don't want to harm others. So the moment you feel that there is a doubt that you have had an infection, you need to inform the healthcare setup, get in touch with them and inform about your arrival so they can take necessary measures that you can quickly be taken care of, and also you are preventing. Because if you go to the hospital and wait in the waiting area for hours together, you will be spreading infection to all the ones with low immunity, which is sad, which is not right. Okay. Another very important thing that you need to remember is, if suppose you have an infection, wear a mask to prevent transmission. If you're sneezing or coughing, you can use the elbow or the shoulder, or better still, use disposable tissue papers and use them when you cough, and then immediately dispose of them to the nearest dustbin that is available to you. Okay, so this is how you're going to take care about this. And the moment you have sneezed or coughed, again your hand is infected and you'll be touching everywhere, use a hand hygiene again. Remember, it is a strategy of prevention which can prevent the widespread reach of a virus. Now, in this present era, when we are worrying about a pandemic reaching out to the largest population, the only thing which works the best is using sensible methods to try to protect yourself as far as possible. We as healthcare workers are extremely at risk because we meet so many patients. But you, if you are not a doctor and you are at home, you can try to work in a strategy to avoid unnecessary crowded area, and never ever try to go to places where you feel that someone is sick and you want to see them socially. It is really not right. It is stupid rather. Okay. But remember, it is not as dangerous as we are scared about, for a simple reason that more dangerous viruses have been controlled globally. So this is just a matter of time, and we hope and pray that we'll be able to quickly find treatment and prevention vaccinations for this, and things will fall in place. All the very best. Stay happy, stay healthy. From Team Lenest.